Plastic surgery around the breasts for women can be quite multifold. Most women who come for plastic surgery and the breast struggle with self-esteem. Some of them feel they don't have a very feminine look if they're very flat-chested, but also some ladies have had changes during their lifetime because of aging, and the skin elasticity is changing, so the breasts are changing. Several women had children, and after breastfeeding, the breasts are changing. There's lots of reasons why the body changes, and this is part of the reason why women come for breast surgery. Another reason could be breast asymmetry, which is usually congenital, so that one breast hasn't developed exactly the same as the other side, and that also can give you a knock on your self-confidence. I think these are the main two reasons why we see women coming for breast surgery. So breast surgery is, you can enlarge the breasts, that's called a breast augmentation. Then you can reduce the size of the breast, that's called a breast reduction. Or you can do an uplift of the breast, that's called a mastopexy. And in case of asymmetry, you can do a symmetrizing procedure, which can be either an enlargement or reduction or a combination of it, depending on what the preoperative finding is, of course. When it comes to the enlargement, majority of cases would use an implant. They're mainly silicone based. In theory, there's also the option of a free flap reconstruction. This is more for cancer patients, so it's not really cosmetic. And also lately, a lot of enlargements or a combination of implant with fat transfer is an option. The reduction is effectively reducing some tissue, reducing some skin, and reducing some breast tissue. And again, depending on the size of the breast before the surgery and the wish of the new size, you reduce more or less of the tissue. With the uplift, you effectively only remove skin to make sure the nipple and areola come to the right position, because they're usually sitting too low. Depending on what type of surgery we have done, there's a risk when you use implants. Implants bear their own risks within. It's effectively a foreign body, and we very closely discuss all these risks with the patient. It can change the way you can do breastfeeding. For instance, if you have done a mastopexy, which is an uplift, or a reduction, you might not be able to breastfeed. Also, the sensation of the nipples can change and can be potentially even losing your sensation. Also, the sensation around the scars can change. These are sort of the more long-term implications of the surgery. The actual surgery, of course, has their own risks, which is a bit more detailed. I don't think the format here will cover it. But I think the main important things to know is that breastfeeding and sensation can change if you have an uplift or reduction. And if you do implant surgery, it has to be discussed very closely, the specific risks of the implants. It's very much dependent on the patient profile, what procedure is needed. And of course, on the patient wish. If the patient comes for simply the wish of a breast enlargement, we'll have to discuss with them what is a sensible option, what is technically doable, because not every size of implant and every type of implant will fit a certain patient profile. When it comes to reduction or uplift, it's dependent on, again, the age of the patient, the skin elasticity, the volume of the breasts. This is how we decide which of the procedures might be suitable. At times we have to combine an uplift with an augmentation, with an implant, to achieve the volume, but also the right position of the breast. And this is how we decide ultimately. Breast surgery is actually not as painful when it comes to recovery, and recovers quite quickly. If everything goes to plan, the skin usually is healed after 2 weeks. And as I said, it's not a very painful procedure because we are pretty much on the surface of the body. Usually we advise the patient to wear a compression bra for 12 weeks after the surgery, just to keep the breasts in the right position, and particularly the implants need to settle down first. We do tell patients to reduce activity, physical activity or sports activities for the first 4 to 6 weeks after the surgery, but shorter walks are able in the first 2 weeks after the procedure. So generally it's not a very difficult recovery, I would say.